interested in is the working relationships between nurses and physicians. Although I'm not currently involved in a funded research project, I'm involved in facilitating a number of activities both at the University of Virginia, Schools of Nursing and Medicine, and at the national level for a group called the National Academies of Nursing. And as I recall, that I had a long, busy day, having seen about 76 patients, all of which I felt very nervous about my knowledge base when the emergency bell rang and a patient with asthma was standing outside the door. And I was so grateful that finally a patient had arrived who I was very well trained to care for. Unfortunately, what I failed to notice after I let the patient in for the first few minutes is that all of the nurses had gone home. And while I knew exactly what to order for that patient, the right intravenous medication, the right nebulizer, there was no one there to make the link between what I knew needed to happen and what actually could happen for the patient. I realized that physicians are trained in something called the proof factor. We believe somehow that when we write something down on a chart or put it in a computer, that some kind of magic happens in between, and all of a sudden there's an IV or there's a nebulizer and the patient is well cared for. And it's really not clear to physicians what all that nursing does for the patient. Work is looking at how we can engage medical and nursing students in interprofessional education at all levels of their education, so that then when they get out in practice, they're much more effective at collaborating with one another